Hi, I'm Dr. Fariba Dayhim, bariatric surgeon, medical bariatrician, and nutrition specialist. Two of the most common questions that patients ask when they come to start their weight loss surgery journey is, will I get a lot of excess skin after I lose weight? And if I do, will insurance pay for it to be removed? There are many factors involved in it. The first factor is amount of weight loss. So if you're losing 100 pounds or more, which is very typical and very common with weight loss surgery, yes, you're bound to get excess skin. However, there are other factors involved in addition to the amount of weight loss. For instance, your age, your genetics, your body form. If your weight has been generalized or more centralized, dictates where you are going to get excess skin. So for instance, patients with too centralized weight typically have a bigger belly, and as they lose the belly, the gravity does its magic and drags it quite down, so they may get a lot of excess skin in the area of abdomen. As mentioned, your age and your genetics also play an important role. So for instance, some of us get wrinkly sooner during the life, and that's our genetics. And also people with younger skin typically bounce back faster. They have still more collagen and elastin in their skin that pulls the skin back together. There are also other factors involved, such as your nutrition and hydration. So as you lose weight, if you maintain good nutrition and good hydration, that also helps with the quality of the skin and the ability of the skin to bounce back. The amount of exercise also can help with less excess skin. How does that work? Our muscles are connected to underneath of our skin with invisible lines, like you see in this image. So as you exercise and gain more muscle, the muscle is bound to pull the skin a little bit. History of smoking is important as well. Although you're not supposed to smoke after weight loss surgery, and you probably quit at least 6 months before weight loss surgery, if you have a long history of smoking, your skin quality may have been already affected. And this may affect the elasticity of your skin and the health of your skin. So there are some things that you can do to decrease the amount of excess skin, such as maintaining your hydration and nutrition and taking your vitamins advised by your bariatric surgeon or your dietitian as you're losing weight. Also exercising as you're losing weight, and obviously you're not supposed to smoke after surgery. You do like to lose as much weight as you can lose. So for instance, if you're someone who can lose 200 pounds with weight loss surgery and you're losing it, I wouldn't worry too much about excess skin. That can be removed. Typically 18 months after surgery, when your weight is stable, we can discuss that. Now, the second question, does insurance cover for excess skin removal? It depends on where your excess skin is. Some insurances may cover for skin removal in the abdominal area. Not all insurances do that, some may do, and it has to be medically necessary. So they have criteria to show it's medically necessary. So what are those criteria? The criteria typically depends on amount of weight loss. Some insurances require at least 100 pounds weight loss before they consider it medical necessity. Some require at least 75 pounds of weight loss. So if your weight is in a range that you don't have 75 pounds to lose, you typically don't get weight loss surgery. So, it's not a question of that much excess skin anyway. The other criteria is how big your hanging belly is. So some have grades based on if it covers the genitals, if it covers the upper part of the thigh, if it comes to the half of the thigh, Some insurances have other criteria which is based on size, like they have criteria it has to be at least 2 inches below pubic bone. And these are the things that during your exam we can document and we can submit it to insurance if your insurance is one of those that actually does cover these procedures. Now, another important criteria is that it's causing medical issues. So you have to have documentation of recurrent rash despite treatment. So for instance, if you did your weight loss surgery last year and you have seen your primary care provider and GYN doctor several times with severe yeast infection underneath your belly, you want to keep those records. And we can submit those notes to your insurance when it's time to discuss panniculectomy or abdominoplasty, removing the excess skin, or more complex procedures. Now, the procedures that we can do for the excess skin in the abdomen, one of them is panniculectomy, which means removing the excess skin underneath the belly button. We can do an extensive panniculectomy, which means just going up with the excess skin, and if your belly button is actually hanging below pubic bone, to get more skin, we can actually remove all of this area. And this is an extensive panniculectomy still with removal of the belly button. There are procedures that are of more cosmetic nature, such as abdominoplasty. This is when we not only do the panniculectomy, but also we raise this flap of skin, excess skin, all the way to almost your rib margins, and then we pull everything down and remove it and try to shape it. And we will also circumscribe your belly button during this procedure and then find a new location for it, because as people have gained weight and then lose it, the belly button can be displaced lower than it should be, and if we just keep it there, it may not be aesthetically appealing. So we may reimplant it in a new spot that looks more natural. So during the same procedure, if your two rectus muscles, these are the six-pack muscles, not everybody has a six-pack, but everybody has the rectus muscle. The rectus muscles may have fallen apart, may have created a gap between them, created something called rectus diastasis. As we raise the flap, we can actually bring the rectus muscles to the midline again, give the abdomen a better shape. This is not creating a six-pack. The six-pack has to be created with exercise. But what it does is that looseness of the internal abdominal wall is going to be eliminated. It's going to be a firmer, nicer belly. Now, some patients have so much excess skin that the skin actually goes behind their back. Usually the skin in the back is not covered by any insurance, as is the skin in other areas. So for instance, if you have excess skin in your arm or in your legs or in your thighs, in your back area, flaps of skin after you lose tons of weight, those are considered cosmetic by your insurances, and I haven't heard of any insurance covering any of those. If removal of your excess skin in the area of the belly seems to be medical necessary, we will do our best to submit it to insurance and get approval, and this is only if your insurance does even approve the codes. So as you can see, there are two codes that are associated with panniculectomy and abdominoplasty. Your insurance may cover one or both of them. You have to call your insurance and ask them to send you the criteria. Again, there are 3 categories of criteria that they want: amount of weight loss, size of belly. They have different criteria for size of belly or amount of weight loss, and also medical necessity, which is typically recurrent rash. Some insurances also accept back pain. Ask them to send you their criteria. What do they need to see in your chart to actually cover it? And then you can see if you have it or you don't have it. Nevertheless, insurance covers it or insurance doesn't cover it. When you want to remove it, you can talk with me. It's typically about 18 months. I usually recommend not to do it before that, because you can still be losing weight or gaining weight. We want you stable before we discuss this. Now, if you have skin in other areas of your body, I typically don't do it myself, but I ask my excellent plastic surgeon colleagues to take care of those. I have significant experience with the abdomen part, and I take care of my patients myself when it comes to that department. You can direct your questions to frontdesk@drdayhim.com, or you can leave comments below, and I try to get to the comments and questions and answer them for you in coming videos, or if they are something that I can answer right there with a short answer, I answer it at the bottom of this video. For more information about tummy tucks, you can also go to my website, drdayhim.com.